Hey there, thanks for joining us. It's Alicia and Dr. Dunlap of Coshocton Dentistry. And Dr. Dunlap, today we are discussing canker sores. So those annoying little spots you get in your mouth, I've had them, maybe you've had them as well, and they hurt. They're definitely not pleasant. So you're gonna kind of just talk to us a little bit about those today. I got a couple questions for you. The first one is, how can I stop canker sores from appearing in my mouth?
Well, it's a really tough one. They usually come on with stress, and most patients and most people have stress in their life. I think sunlight. There's different things that potentiate them, but most of the time it's stress related, and not a lot of great ways to stop them. Most of the advantages that we know, aphthous ulcers or canker sores are self-limiting. They only last a couple weeks, and at the most usually, and then you're back to normal eating. But it is definitely uncomfortable. I get lots of patients that have the issues, and it's a challenge.
Okay, that's interesting to me. I didn't realize that one of the main causes was stress. I like to say that I'm not super stressed out all the time, but I think, that's definitely something that I experience, and I'm sure I'm not alone. So like you said, they're short, they don't really last very long, but when we are experiencing them, they can be just awful. They can make us not even want to eat. So are there any over-the-counter treatments that are successful?
Yeah, I think there's a few, but truthfully, you're just basically mitigating the pain as much as you can. There's a drug or over-the-counter product called Xylactin that we prescribe a lot of times for patients to go pick up. It's not too bad. It's a little gel that goes over the top of the ulcer and just kind of helps things. It's a coating, just kind of keeps the drinks and food off of the sore area. So that's a reasonable way, but like I said, it takes time, and you got to be patient, and it's not fun.
Yeah, no, absolutely not. So you said that sometimes you prescribe that to patients, but then other times, it's just a matter of kind of waiting it out. So something that people are definitely asking is, can the dentist treat canker sores? And the answer would just be that you would prescribe that medication maybe, or?
We've got some alternatives. I mean, we use lasers sometimes for large lesions like that, which will kind of help take away some of the sensitivity as well. It works pretty good on those situations. So, on the larger ones, I think that's a reasonable approach to come see your dentist and have them see if they can help you in that way.
Gotcha. Okay, well, that's really good information to know. Definitely make sure that you keep that in mind, especially if you're experiencing large, painful canker sores. And rest assured, if you do have a smaller one, there are some over-the-counter stuff, but they will only last for a short amount of time. So just hang in there. And if you're interested in learning about any more topics such as this, make sure you're checking out CoshoctonDentistry.com. On the blog, we have a ton of videos that are very informative. And I just kind of ask the doctors different questions, and we get that information out there to help educate you. And if you're interested in scheduling an appointment with Dr. Dunlap or even Dr. Lauper at Coshocton Dentistry, make sure that you get in contact with the team. Thank you.
Thanks, Alicia.